You're watching The Source on CNN Philippines. I'm Rieta Cotrillo. The Department of Health confirmed cases of walking pneumonia in the country, but it clarified that the bacterial infection that typically affects younger children is not new nor unusual, and it is treatable and preventable. DOH said 4 cases were detected this year, but all of the patients have recovered. It said the cases of walking pneumonia with the medical term Mycoplasma pneumoniae comprise of only 0.08% of the total cases of influenza-like illnesses in the country. Our source today, Philippine College of Physicians President Rontgene Solante. Dr. Solante, good morning. Thank you so much for being with us here on The Source.
Hi, good morning, Maria.
All right, lots of questions to ask you. But first, let me start with this. The Philippines reported 4 cases of walking pneumonia since January of this year. And the health department said that these cases have already recovered. Is this still a cause of concern for you?
Well, Ria, Mycoplasma pneumoniae, or the cause of the walking pneumonia, can only cause a very mild symptoms. And the most common symptoms is cough, sore throat, and majority of those who are infected will just recover even without antibiotic. And I think this is not the most common cause of the influenza-like illness. It's still the viral infection like your flu, your respiratory syncytial virus, and even COVID. It's still those viruses that are really circulating compared to this walking pneumonia or mycoplasma pneumonia.
All right, so doctor, there's so many, I read so many things going on in the internet, people spreading so much information. It can be overwhelming and sometimes it's not even reliable. So could you help us understand the difference between walking pneumonia, how that is different from the seasonal flu, and how that is different from COVID-19?
Well, one, COVID-19 is still the most common among the influenza-like illness. And we know that COVID-19 can cause a more severe form of infection in the vulnerable population. It presents with cough, it presents with sore throat, just like your influenza. But if you talk about COVID or the walking pneumonia, it's a bacterial infection. It's self-limited, meaning after 7-10 days, or the most is 2 weeks with cough, you will just recover. Unlike with your influenza or your COVID, a lot of times, especially for those vulnerable population, like the elderly, those with comorbidities, it can really go bad, can lead to complications. So I think we need to tone down that panic or fear that the walking pneumonia is increasing. It is expected, Ria. No? These are the months that we see a lot of respiratory illnesses, whether it's bacterial or viral, and we just need to wear our face masks. We just need to be very cautious with ourselves.
All right, so how urgent is the need to be tested then? Should we be testing ourselves for COVID? Should we be testing the kids for walking pneumonia? When is it key or essential to get tested?
Yeah, that's a very important question because we don't normally test patients or individual for a walking pneumonia. No? We test them, especially for populations that will have a higher likelihood of severe pneumonia, like the elderly, again, or the very small children that has also comorbidities, not just ordinary children, but has comorbidities or they are also immunocompromised. We need to test them because we want to know if it is COVID, there's treatment, if it is influenza, there's treatment, or if it is mycoplasma. But in general population, or most of the time, we don't test them because a lot of times this type of infection is self-limited, and most or majority, they will just recover even without treatment.
All right, well, that's certainly good to hear. But for those who need testing, specifically for COVID, is it okay that we'll just test ourselves at home? Or would you say that it would be preferable to be tested in a hospital?
Well, I highly recommend, especially for those who will be attending parties, attending gatherings, and they have symptoms. Again, I would still encourage them to test themselves for COVID because if they will have or they will be positive, then they won't be going there and they won't be transmitting the infection, especially for the vulnerable population. But in general, I think we don't need to test for the general population as long as they have the test and they have that awareness that they will not be transmitting the infection to other people, especially the vulnerable population, that's an option. And using antigen tests at home is still a good test.
All right. Now, going back to walking pneumonia, you said it is self-limiting, and within 7 to 10, maybe 14 days, the patient should just recover. But given that, when they are sick, what is the treatment for this? Or is it just, ordinary over-the-counter meds that they would take?
Well, if they have fever, then they can take the paracetamol or those to prevent the occurrence of fever or to treat the fever. If they have cough, they just have to rest. There are cough preparations that they can also buy. But most important here is they have to rest because your body needs to recover, and resting is an important part of any viral infections or any infections. And until such time that you'll be able to recover, then that's a good time that you can work again.
All right, and all these illnesses we're talking about, especially the pneumonia and the flu, are they really more common with children? And I suppose the treatment would be the same, right? Paracetamol and cough meds.
Yes, Ria, no, because children are vulnerable, and we know the impact of the pandemic. These are infections that we see before the pandemic, but when we have the pandemic, we are all wearing our face masks, we are all observing social distance. And now these are common to see, particularly children, because their immune system is not yet as good as the adult, and that's why they are the vulnerable, especially the children less than 5 years old. These are the most vulnerable population, including the 65 years old and above.
All right, so below 5 and over 55. Still so much to talk about, Dr. Solante, but we will be taking a short break. This is A Source on CNN Philippines. Do stay tuned. You're watching The Source on CNN Philippines. I'm Ria Tanwat Cotrillo. Our source today, Philippine College of Physicians President Rontgene Solante. Doctor, welcome back to the program once again. Before the break, we were talking about, different respiratory illnesses that have been going around. In your view, should the DOH recommend mandatory use of face masks again? If so, in which areas?
I think at this point, it's not advisable or recommended yet to wear the mandatory face mask because the cases are still manageable. Even the hospitalization rate of this common influenza-like illness are not so alarming. We still don't see the scenario that we experienced with COVID. So it's just something that we need to advise the public, especially during this month, during this gathering, the Christmas season, that they have to be careful in going out when they will be attending parties or gatherings. As much as possible, if they don't have symptoms, they should attend. If they have symptoms, they just have to stay home and rest. And most likely, we have to recommend also wearing face masks if there are vulnerable populations attending these gatherings. So I think we don't need a mandatory face mask at this point in time.
Right. And it really is a personal choice. I mean, if you want to wear a face mask, nobody's going to stop you doing that either, right?
Yes. And I think the lesson that we learned with COVID during the latter part, educating the people on how to protect ourselves, so important because as we look into post-pandemic, we will be seeing a lot of these respiratory viruses, bacteria, and there will always be outbreaks or spikes of cases that somehow we should not be alarmed. We know how to protect ourselves, and we need to continue that knowledge that we learned from COVID.
Absolutely. I think that's so important. We know what to do. And again, to allay the fears of many people out there, there's nothing new out there right now, right? There's no new virus or bacteria that we haven't seen before or don't know how to treat.
Yes, correct, Ria. And this is just an expected event because with the relaxation now of the health protocols, this is not unique with the Philippines. More other Asian countries, other European countries are also has this experience of increase in the influenza-like illness. So we just have to be very careful and continue to monitor the event.
Right. You mentioned other countries there, Doctor. How is the situation in other countries in comparison to what we're experiencing here in the Philippines?
Well, in fact, there are countries like in Europe and in some neighboring countries, increase in the influenza-like illness. There isn't any mandatory wearing of face masks. It's just really advising the public to, they are in the vulnerable population. They have to consult their doctor. There are treatment available, but I think the overarching importance here, important aspect here, is we need to again advocate for vaccination, especially for flu vaccination, pneumococcal vaccination, particularly for the vulnerable population, because these are some of this, like your influenza, is vaccine preventable. Your bacterial pneumonia is also vaccine preventable.
All right. And at this point, doctor, do you see a need for travel advisories? Because I think some countries might have issued some already. Do we need to do that for the Philippines, issue travel advisories to other places, or even a need for border control?
I don't think a travel advisory is needed at this point in time, but if airlines can also give some additional, not warnings, but advice to passengers to also wear the face mask when they will be in the airport, in the crowded areas, that would really help, no? Especially for the elderly passengers and for the younger kids. So to lessen the impact of the transmission when they will be visiting countries also with influenza-like illness occurring.
All right, so to be clear, there's nothing unusual with the rising number of respiratory cases. But when might we see these cases actually go down?
Well, if you look at some of the trends in previous outbreaks of the walking pneumonia or increase in the influenza-like illness, it usually goes down latter part of January and then February. Then usually it peaks again August, September, October. So those are the what we call the seasonal peaks of influenza-like illnesses.
All right, so part of it is, take care of yourself, but also just wait it out. But while we are in the thick of it, doctor, maybe you can give us some tips and reminders on how people can protect themselves from walking pneumonia and other ILIs.
Okay, very important. No, the knowledge that we have learned with COVID. This is a respiratory type of illness. The most common symptoms is cough. Then the most important layer of protection is really wearing the face mask. Whatever face mask is that, a cloth mask or a surgical mask, as long as there is protection of your mucosal area, that is enough. And then if you are symptomatic, then you need to rest and observe yourself. 7 days, 10 days, most of the influenza-like illness will just disappear. Don't panic. But if you are in the vulnerable population with comorbidities, 65 years old and above, these are the people that really need to be seeing doctors, consulting doctors, especially the children also less than 5 years old. Just make sure that they're okay and appropriate treatment is being given.
Right, doctor, regarding COVID, do you have the current numbers of the number of infections in the Philippines? And are we seeing any kind of trend here?
Well, in the last DOH advisory, as mentioned, there is quite an increase in the number of COVID cases. And we look at COVID cases as just like an influenza-like illness, no? Because of the manifestations of cough, fever, and sore throat. Now, it is also, this is something that we also should monitor. And when we monitor COVID cases, the most important parameter to monitor is if there is increase in the hospitalization rate. Because if there is increase in the hospitalization rate, then we should be alarmed with it, because it might be something of a virulent variant or something like of a new variant of concern or interest. No? So for now, cases are increasing, but the hospitalization rate, the ICU admission rate for COVID is still very low.
Okay, that is good news. Is this one of the things that we can attribute to the effectiveness of the vaccines, doctor? Yeah,
there are multiple factors here, Ria. One is most of the population has already received a vaccine, but we know that the efficacy of the vaccine has already waned because we're now facing a different variant of COVID. Our previous vaccine has protected us only with the previous variant. I think it has something to do with the nature now of the COVID virus, wherein it is less virulent and less to affect our lungs. No? It's more of an upper respiratory tract infection.
All right. Again, that is some good news there, doctor. Thank you so much for enlightening us here on The Source this morning. We do appreciate it. That was infectious disease expert, Dr. Rontgene Solante. And thank you for joining us here on The Source. Sitting in for Pinky Web, I'm Ria Tanwat Cotrillo. You're watching CNN Philippines.